Mental health is often misunderstood, shrouded in myths and misconceptions that impact how we approach it. Today, we're going to break down some of the most pervasive mental health myths, expose the truth behind them, and provide you with new insights based on facts, research, and data. Let's dive into these misconceptions, challenge what we've been taught, and get to the heart of what mental health really is. Why mental health matters. Mental health affects everyone. According to the World Health Organization, around 450 million people worldwide are currently suffering from mental health conditions. Yet, despite these staggering numbers, the stigma surrounding mental health persists. But why is this the case? Much of the stigma comes from the misinformation and myths that people continue to believe. Let's explore these myths and the truths behind them. Myth 1. Mental illness is rare. This is one of the most harmful myths out there. The idea that mental illness is uncommon makes people who suffer from it feel isolated and misunderstood. The truth: mental illness is far more common than many people think. In fact, according to the National Institute of Mental Health, approximately 1 in 5 adults in the US experiences mental illness in a given year. Globally, that translates to about 970 million people suffering from some form of mental disorder. What many people don't realize is that mental illness comes in many forms, from depression and anxiety to bipolar disorder and schizophrenia. It's not something that happens to other people, it could happen to anyone, at any time. Myth 2. Mental illness is a sign of weakness. This misconception dates back to ancient times when mental health problems were seen as moral failings or spiritual deficiencies. Some still hold this belief today, thinking that if someone were just stronger, or had more willpower, they wouldn't suffer from mental illness. The truth: mental illness has nothing to do with personal weakness. Mental health disorders are medical conditions that affect how your brain functions. Depression, for example, is often linked to chemical imbalances in the brain, while conditions like anxiety and PTSD can result from trauma. It's no more a weakness than having diabetes or high blood pressure. According to the American Psychological Association, people who seek help for mental health problems are actually displaying strength by taking steps to improve their well-being. Controversial thought: what's fascinating, and a little controversial, is that recent studies are showing that those with mental health conditions, like anxiety, may actually have heightened cognitive abilities in certain areas, such as problem solving and awareness. Rather than being a sign of weakness, these individuals may have adapted in ways we don't fully understand yet. Myth 3. Therapy is only for crazy people. Many people believe that only those with severe mental health issues need to see a therapist, and that therapy is a last resort for those who are crazy. The truth: therapy isn't just for individuals with severe mental illnesses. In fact, therapy can benefit anyone, whether they're struggling with stress, going through a tough life transition, or just trying to better understand themselves. According to a survey conducted by the American Psychiatric Association, nearly 50% of Americans reported that they would benefit from mental health treatment at some point in their lives. Moreover, therapy isn't just about talking, it's about learning coping skills, gaining self-awareness, and building resilience. Cognitive behavioral therapy, CBT, for example, is a powerful tool for managing anxiety and depression. It teaches you how to change negative thought patterns and can be applied to everyday challenges, not just clinical disorders. Myth 4. Children don't experience mental health problems. There's a misconception that children can't possibly suffer from mental health issues because their lives are relatively stress-free. This is a dangerous myth that can prevent children from getting the help they need. The truth: children are not immune to mental health issues. In fact, according to the Centers for Disease Control and Prevention, CDC, about 1 in 6 children in the US aged 2 to 8 years old has been diagnosed with a mental, behavioral, or developmental disorder. Anxiety, depression, and behavioral disorders are among the most common issues children face. Early intervention is crucial for helping children manage these conditions. Ignoring mental health issues in children can lead to more serious problems in adolescence and adulthood. Myth 5. People with mental illness can't hold down jobs. Many believe that having a mental illness prevents people from being able to function in day-to-day life, including holding a steady job. The truth: this is one of the most harmful stereotypes. The reality is that many people with mental health conditions live productive and fulfilling lives, including maintaining successful careers. A study by the National Alliance on Mental Illness, NAMI, found that 62% of individuals diagnosed with mental illness are employed. In fact, some mental health conditions, when properly managed, can enhance certain professional abilities. For instance, individuals with ADHD often excel in creative and fast-paced environments. It's all about finding the right balance and getting the appropriate support. Myth 6. Mental health problems are permanent. People often believe that mental health conditions are lifelong sentences with no hope of recovery. The truth, mental health problems can be managed, and many people recover fully or are able to live productive, fulfilling lives. The key is early intervention and proper treatment. The WHO estimates that 70% to 90% of people with mental health disorders improve significantly with appropriate treatment. Recovery may not mean a complete disappearance of symptoms, but it does mean the ability to live a balanced life. The recovery process looks different for everyone and is often a combination of therapy, medication, and lifestyle changes. Myth 7. Medication will change your personality. There's a widespread fear that taking medication for mental health issues will fundamentally change who you are. The truth, medications like antidepressants and mood stabilizers are designed to help balance chemicals in the brain, not to alter your personality. They work to manage the symptoms of mental illness, allowing you to live a more stable life. According to Harvard Medical School, 70% of people taking antidepressants report significant improvements without drastic personality changes. Of course, finding the right medication can take time and requires working closely with a healthcare provider. But when used correctly, medication can be a life-changing tool in managing mental health conditions. Myth 8. You can just snap out of it. This is one of the most dismissive myths out there. The idea that people suffering from mental health issues just need to get over it, or think positive. The truth, mental health disorders are not a matter of willpower. Telling someone to snap out of it is akin to telling someone with a broken leg to just walk it off. According to the National Alliance on Mental Illness, 90% of people who die by suicide had an underlying mental health condition. This statistic highlights the severity of mental health issues and the fact that they are not simply problems you can wish away. Treatment, therapy, and often medication are required to manage these conditions. Myth 9. Mental illness is all in your head. One of the most enduring myths is that mental illness is purely psychological and doesn't affect the body. The truth, mental health is deeply connected to physical health. Mental health conditions, particularly chronic stress, anxiety, and depression, can have real physical symptoms. Chronic stress, for example, can lead to conditions like heart disease, weakened immune function, and gastrointestinal problems. A report by the Mayo Clinic highlights that people with depression have a 40% higher risk of developing cardiovascular and metabolic diseases than the general population. Myth 10. Only the mentally ill should care about their mental health. There's a misconception that unless you're dealing with a specific mental health diagnosis, you don't need to worry about your mental health. The truth, everyone should care about their mental health, not just those diagnosed with mental illnesses. Mental health is a spectrum, and maintaining mental well-being is as important as maintaining physical health. Regular self-care, mindfulness, exercise, and therapy can help prevent mental health issues from developing. According to a study from the National Alliance on Mental Illness, 80% of people who regularly engage in self-care activities report improved mental health. The truth is, mental health is everyone's responsibility. Dispelling the myths. It's time to stop believing the myths that surround mental health. By understanding the facts, you can not only better support those around you who may be struggling, but you can also take proactive steps in caring for your own mental well-being. The stigma around mental health is driven by misinformation, but as we've seen, the reality is far more nuanced, supported by science, and much more hopeful than these myths would have us believe. Mental health isn't something we can afford to misunderstand.